having engaged in psychedelic research, well, maybe some. Having engaged in psychedelic research, one of my first projects actually was looking at methylene dioxymethamphetamine ecstasy under a United States Navy grant for the possibility of weaponizing ecstasy as a volatile agent, as a viable agent, particularly against submariners. So the understanding that the psychedelics could in fact be used in a variety of different ways, inclusive of weaponization, is not new. We look back to the older projects such as MK Ultra, Mind Control Ultra, which utilized lysergic acid diethylamide and psilocybin to be able to alter the cognitions, emotions, and behaviors of individuals to see if that could be leveraged not only against our own people, but against others, sort of the whole brainwashing, mind-changing effect. However, one of the things we've come to recognize is that the mechanisms of these psychedelic agents is far more specific than we thought, and in fact, can be incurred at far lower doses than were heretofore attempted either experimentally or in social practice. So there's a regenerated interest, a revivified interest in re-examining the mechanisms and effect of these psychedelic compounds, inclusive of lysergic acid diethylamide, psilocybin, dimethyltryptamine, as well as some that are sort of like borderline on what might be considered a psychedelic, such as the affiliative drugs like MDMA, at microdoses or sort of intermediate microdoses, not only to treat individuals who've had particular neuropsychiatric spectrum disorders, and there's a growing body of research that would suggest that even one-time administration of a therapeutic dose of LSD or psilocybin and/or MDMA may have very profound therapeutic effects against certain forms of PTSD, intractable depression, and beyond the military framework, even certain forms of psychosis. We also recognize that these things may be useful in treating forms of TBI, treating other forms of psychiatric and neuropsychiatric disorders, and may also be viable as performance enhancers, particularly if given in a very specific regimen at a very controlled dosimetry. So to think like so many other things, the more we're learning about the brain suggests to us not only what we know, but what we didn't know, some of the errors in our previous ways of experimentation and empiricism, and that allows us to revisit these things under a newer and I think more granular perspective that I think may demonstrate certain benefits, as well as giving rise to concern about certain burdens and risks. So I think that it certainly warrants continued research, and I think that we need to be cautious in how we interpret that research and its translational effect, but I think there's great benefit to be gained there.